Hello, my name is Xavier Aguilar, and today I'm going to be presenting a case study about a 58-year-old Hispanic male who was cutting his grass and he tripped and twisted his ankle. This patient came into the waiting room complaining about ankle pain. When I helped him get on the wheelchair to bring him to the x-ray department in the ER, he was not able to walk or put any pressure on his right ankle. So immediately after taking the AP ankle x-ray of this patient, I realized that he had a fractured medial malleolus. So now, knowing this information, I still had to proceed with the exam, but it prompted me to do so in a much more cautious manner. So I took an oblique image of his right ankle, which is this one we're looking at. And lastly, I took a lateral ankle image just to inspect the tibial-talar joint space for further damage. On a side note, since we have to take a chest image as protocol for every patient, this was actually done before the ankle x-ray, and I had already interacted with the patient, and thankfully I was wearing my proper PPE. But come to find out later, and I kind of figured from the x-ray too, but the patient did end up testing positive for COVID. So I finished up the exam, and then we sent the patient back into his room, and the doctor ended up scheduling a surgery with him for the following week. Fast forward to the following week, and we're now in the OR, and this patient's undergoing surgery. So what they have here is basically a clamp. That curved tool that they use is to hold the distal end of the medial malleolus close to the tibia, and then that long line going through it is actually a guide wire that they insert just to make sure they have the correct positioning before inserting the surgical screws. This is a AP fluoro of the insertion of the second guide wire where the second surgical screw will be placed. We then took a lateral image of the two guide wires and the initial surgical screw just to further ensure the correct positioning. This is an AP image of both of the screws inserted, and now we're going to remove the two guide wires, and voila, the patient's medial malleolus is now reconnected to the distal end of the tibia thanks to the two surgical screws that were inserted by the surgeon. An internal oblique image was taken after the two screws had been set in place, and lastly a lateral image was taken. And that's the end of this procedure. Since this operation happened very recently, I haven't had a chance to reach out to the patient and see how he's feeling, if he's doing any better. But that's my case study, and I hope you enjoyed it.